Hi, my name is Nicole Sammons. The drug that I picked was marijuana, aka Mary Jane. Types of marijuana category: the present, containing calming and sleepy, stimulation, raised. Marijuana act. Chemical trade names on marijuana. Marijuana street names are blunt, dope, ganja, grass, herb, joint, bud, Mary Jane, reefer, green, trees, smoke, skunk, weed, hash, tea, chronic, and loud. Chemical structure on marijuana. In this diagram, the epidermis cannabis is another word for anodyne. As you see in the diagram, now this is a function of neurotransmitters because they send chemical message between nerve cells throughout the nervous system. In fact, they affect brain areas that influence memory, thinking. History of use of marijuana. Original in China or Central Asia in times 10,000 years ago, the world high could have occurred about 600 5000 BC. Social hospitalized 200 AD. Source of ropes and cells 3rd century Rome. Marijuana Tax Act occurred in 1937. Utilized. Method of manufacture on marijuana. Synthetic marijuana is that it isn't just one thing, it's more like a category of things. It's a family of man-made chemicals that have one major characteristic in common, but they do interact with the same cells receptors in the brains as THC, the active ingredient in natural marijuana. Now, when growing marijuana, the variables such as light spectrum, nutrition, uptake, water cycle, temperature, humidity, and airflow. Retinol iodine found in several regions of the brain, but not that much in the brain stem. Other psychoactive drugs, THC active neutrons, because its chemical structure mimics the natural neurotransmitters, which can directly and indirectly target the behavior's reward system by flooding the concurrence with dopamine. The neurotransmitters that are affected by marijuana are dopamine and norepinephrine. Now, dopamine has a variable of role in the brain, such as attending and gratification. Norepinephrine, on the other hand, has an effects, action, and response. Also, THC is the active ingredient in marijuana that cause change in the brain. In fact, marijuana routes of administration. Dosage is the most complex and important factor in using a medication. Is the most frequent cause of serious injury or death from this medication. Basically, the dosage include the correct amount of the drug as well as the route and frequency of the administrations. The LD50, which calls for lethal dose of drugs of 50% of the animal test of cannabis, is 20,000 to 40,000. 1. Now the proper dosage for marijuana is to find the lowest dose that yields the intended benefit with the fewest side effects. As you can see the grid of the routes of the metro, it basically gives details of what the duration onset indicate for the caution of each individual of the routes. Marijuana metabolism. Marijuana can cause active of the cannabinoid and affects tissue involving energy metabolism, such as the liver and pancreas. Although this activation of reduces beta cell function. Toxin on marijuana. Alpagrosis is the most common fungusly infection in marijuana smokers caused by Allegrosa fungigates. Physical/behavior effects on marijuana: dizziness, shadow breathing, red eye, and dilate. Addiction/abuse potential. Addiction potential is that 1 in 10 individuals who try marijuana will ever become at a regular use and display signs of dependence or addiction. At least addiction drugs among substances such as caffeine, nicotine, and alcohol. Although marijuana abuse in the younger population is of a major concern, one needs to be aware that there are other patient groups that also abuse marijuana. There are several individuals with certain pancreas disorders such as stress, post-traumatic disorder, and bipolar disorder, and anxiety have also known to abuse marijuana. Now, this concern has led to many institutions obtaining directly disclosed other marijuana-related problems and a positive urine drug screen prior to undertake any therapy. Treatment for overdose marijuana. Fluid usually, anti-medication especially, medication to control pulse and fluctuating blood pressure, anti-anxiety medication, prevent the user from injury, rest, and professional. Medical use on marijuana: glaucoma, pain. Related drugs on marijuana: Stafix is currently used to treat muscle spasm and stiffness caused by multiple sclerosis. Now, it's composed of two compounds found in marijuana, THC. In fact, the drug delivered through a vaporizer is approved in 25 countries, but isn't available in the US just yet. Marlin and Seismic, FDA approved for the treatment of nausea in patients undergoing chemotherapy, and is prescribed to AIDS patients suffering from loss of appetite. Therefore, the drug is made of synthetic form of the THC and is delivered as an oral capsule. Similarity statistics on marijuana. As you can see, the U.S. contributed sales and the growth from 2011 to 2016. Industry, the industry grows 7.4% in 2014 to 2.7 billion. 82% of the fun fact about marijuana: the name marijuana comes from a Mexican slang term from cannabis and is believed to have derived from the Spanish, which is called Mary Jane. Mary Jane. The counterback. Here's a video on marijuana. Basically, in this video, it would explain what you look like on the inside. Here are my reference. I hope you enjoy.